On the Medical Watch this afternoon, some controversial claims by the Health and Human Services Secretary as he moves to further study autism.
Let's go to medical reporter Dina Baer. She has more on what Robert F. Kennedy Jr. is calling an epidemic.
Lourdes and Ben, at a press conference today, Robert F. Kennedy Jr. cited research he says documents a 300% to 400% increase in autism cases over the last several decades. As more children and families are impacted and the cost of care is rising, he wants more resources devoted to autism studies. And while those who care for children on the autism spectrum welcome the additional focus, they want to make sure the lens is pointed in the right direction.
Overall, the autism is increasing in prevalence at an alarming rate.
According to CDC data, in the last 20 years, autism diagnoses have skyrocketed.
The ASD prevalence rate in 8-year-olds is now 1 in 31. Shocking.
The threat is even greater in boys.
The risk for boys of getting an autism diagnosis in this country is now 1 in 20.
There is more awareness about autism, and diagnostic criteria has changed. But according to Robert F. Kennedy Jr.,
the rates are real.
Better recognition does not account for rising rates.
Because it was not expected that autism prevalence would increase. Other childhood disabilities, neurologic disorders do not increase or change over time.
This is a preventable disease. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. They can provide a vulnerability. You need an environmental toxin.
There's been a lot of study looking at this, and there are a lot of autism experts who have maybe opinions that disagree with the secretary.
The HHS secretary ordered more research, but locally, the head of the Department of Psychiatry and Behavioral Health at Ann and Robert H. Lurie Children's Hospital, Dr. John Walkup says, based on years of research, the autism picture is more complicated.
It's not a simple genetic problem, but it is. I think that it's hard for people who are in the business to kind of say that genetics doesn't play a role.
Whatever the root cause, as an expert who cares for children on the spectrum, Dr. Walkup believes the diagnosis is critical to get those in need early interventions that can make a difference in their lives. Having autism in the spotlight may help. Secretary Kennedy wants autism studied under the Administration for Healthy America's new Chronic Disease Division. Are the cases due to toxins, rising maternal and paternal age? He hopes to have results on a more definitive autism cause by September. But experts we spoke with say that is really optimistic.
A lot of questions. Okay, thank you, Dina.